Well, good evening. It's excited to see everyone here. This is our first attempt at a provider workshop, so glad to see so many faces here tonight, and hopefully it will just grow as the word gets out around our program that's offered tonight. My name is April Ogle. I'm the Director of Medicare Advantage Revenue Management with Health Alliance Medical Plans. I've actually been a registered nurse for 19 years. That makes me sound old. And with Health Alliance for the past 7. Our goal tonight is really to share some industry relevant topics that obviously affect us as a health plan, but also you as a participating provider. So we will be touching on risk adjustment, star ratings, as well as skilled nursing facility services tonight. So just thank you in advance for being here. There is a sign-up sheet going around for CME credit. Or CEU for any healthcare providers. So if you would like to sign that, and then I understand that those will be delivered to you at a later date via email. So I'm actually the first presenter tonight, so we'll just jump right into risk adjustment, and really starting with what is risk adjustment. And as the slide reflects, it's really a method to adjust payment based on patient demographic as well as health status of enrollee. And the reason we really wanted to touch on this tonight is because historically risk adjustment has been around Medicare Advantage. And as a Medicare Advantage plan, we have a lot of experience in this area. But as we expand into new areas with commercial exchanges, some Medicaid population, risk adjustment is really becoming more prominent and involved in a lot of payment strategies. So we wanted to give you just a basic overview of what risk adjustment is and how you can help us with that. I'm going to start with really talking through what are acceptable sources of data to submit for risk adjustment payment at the health plan. Essentially, any diagnosis submitted by acceptable providers or facilities through a face-to-face encounter are acceptable for risk adjustment purposes. An acceptable provider is a physician, nurse practitioner, physician assistant, and that's really only a handful of the acceptable providers. The list is really pretty long at about 35, 40 providers that are considered acceptable. With that, acceptable facilities have to do with inpatient or outpatient hospital facilities. And why we're talking about acceptable providers from a submission standpoint, I wanted to talk just real briefly about diagnostic radiology. And it should be noted that regardless of the type of diagnostic radiology bill, whether that's for outpatient or a physician component with that, those services are actually not acceptable for risk adjustment submission. And the reason behind that is that the diagnostic radiologists typically do not confirm a diagnosis. That's usually the referring physician or a physician extender. So therefore, medical record documentation typically does not support the confirmed diagnosis, which is needed for risk adjustment purposes. I'm going to talk a little bit about diagnosis codes because it is the driving factor behind a lot of risk adjustment payment methodologies. We are obviously following ICD-9 coding guidelines and regulations through September 30th of 2014, and obviously a lot of us are concerned about the shift to ICD-10 next year. So we've done a lot of things at